Hello, I'm Dr. Gauri Somyaji and I'm a pediatrician from Bangalore. Now, what are the things that a parent can do to prevent episodes of this allergic rhinitis? The main thing that is advised is a certain amount of cleanliness. The child's room should be swept and mopped on a regular basis, and not just swept but mopped with a wet cloth so that there is no dust that just gets transferred from one place to another. Avoid having carpets and heavy curtains in a child's room if the child is very prone for rhinitis, because these objects will trap dust. If you do have carpets and curtains, they need to be vacuumed or washed on a very regular basis. All the child's bedclothes must be washed very regularly so that there is no dust trapped on them. Make sure that there is a minimum number of articles kept in the room, because the more number of things there are in the baby's room, there is more surfaces for dust to settle on, and it may not be possible to dust every surface every day. Also, if the child seems to have an allergy to pets, see if you can avoid the pet sleeping or staying in the same room as the child. If you use ACs, air conditioners, please make sure these are serviced regularly. Air filters are cleaned very often so that there is no trapping of dust or reaccumulation of dust in these objects. Also, if you have family members who do smoke, kindly ask them not to smoke within the house, as this smoke tends to settle down on all the surfaces and can irritate the child. Also, avoid using very heavy chemicals in the cleaners and cleaning substances used in the house, because these cleaning substances themselves can have chemicals which are very irritant to the child. When we advise cleanliness and avoiding of dust for the child who is prone for allergic rhinitis, please remember that we do not want parents to over obsess on hygiene and keep wiping every surface 4 times a day, because excessive cleanliness and a complete lack of allergens will also hamper the child's development of immunity.